Question 1. A postoperative client receiving PCA morphine has a respiratory rate of 8 per minute, O2 sat 86%, and is difficult to arouse. The nurse stops the PCA and stimulates the client, but respirations remain shallow. What is the next best action? A. Call the rapid response team and prepare to administer naloxone. B. Increase oxygen flow and reassess in 10 minutes. C. Notify the provider after documenting the event. D. Turn the client aside lying and elevate the head of the bed. Answer. A. Call the rapid response team and prepare to administer naloxone. Rationale. When stimulation fails to improve respirations, opioid toxicity is suspected. Immediate reversal with naloxone and rapid team activation are critical. Waiting or documentation delays rescue. Positioning supports airway, but does not address the underlying respiratory depression. Question 2. A patient receiving IV antibiotics for sepsis develops new-onset confusion, hypotension, and decreased urine output. What is the nurse's first priority? A. Increase IV fluids and notify provider. B. Check vital signs, assess for sepsis progression, and activate rapid response if needed. C. Document findings and recheck in 30 minutes. D. Stop antibiotics immediately and draw new cultures. Answer. B. Check vital signs, assess for sepsis progression, and activate rapid response if needed. Rationale: new confusion, hypotension, and oliguria indicate septic shock. Rapid recognition and escalation of care prevent organ failure. Documentation: C, and waiting delay intervention. Stopping antibiotics: D. Without provider order risks harm. Question 3. A nurse caring for 4 clients must determine priorities. Which client requires immediate assessment? A. Post-thyroidectomy client with hoarseness and mild neck swelling. B. Diabetic client with blood sugar 240 mg per deciliter and nausea. C. COPD client with O2 sat 88% on 2-liter nasal cannula. D. Postoperative client requesting pain medication. Answer. A. Post-thyroidectomy client with hoarseness and mild neck swelling. Rationale: hoarseness and swelling may indicate airway obstruction from hematoma or laryngeal nerve injury, life-threatening. Other conditions are stable or non-urgent by comparison. Question 4. A client refuses a life-saving procedure after being fully informed, but the spouse insists the nurse proceed. What should the nurse do next? A. Reassess the client's decision-making capacity before honoring the refusal. B. Notify the provider and proceed per spouse's request. C. Document the refusal and do nothing further. D. Proceed with treatment to prevent legal consequences. Answer. A. Reassess the client's decision-making capacity before honoring the refusal. Rationale: before enforcing autonomy, ensure decisional capacity. If intact, the refusal must be respected. Acting on spouse's demand violates autonomy. Documentation follows, but is not the next clinical judgment step. Question 5. During an emergency blood transfusion, a client reports chest pain and dyspnea. Vitals show hypotension and tachycardia. What should the nurse do immediately? A. Stop transfusion and maintain IV access with normal saline. B. Administer diphenhydramine and continue transfusion. C. Notify the provider after checking all blood labels. D. Elevate the client's head and apply oxygen. Answer. A. Stop transfusion and maintain IV access with normal saline. Rationale: suspected transfusion reaction requires immediate cessation and maintaining IV with NS for emergency management. Checking labels or giving medications delays safety actions. O2 supports breathing but does not stop exposure to antigen. Question 6. An elderly client with pneumonia develops new confusion, tachypnea, and agitation. What action demonstrates sound clinical judgment? A. Suspect hypoxemia and assess oxygenation before medicating for agitation. B. Reorient and provide calm environment first. C. Call the provider for psychiatric evaluation. D. Document confusion as baseline dementia. Answer. A. Suspect hypoxemia and assess oxygenation before medicating for agitation. Rationale: in older adults, sudden confusion likely signals hypoxia. Assess oxygenation SpO2 ABGs before assuming psychological causes. Sedation without cause assessment risks respiratory failure. Question 7. The nurse receives a critical potassium value of 6.8 milliequivalent per liter in a patient with new EKG changes. What is the priority nursing action? A. Notify provider and prepare calcium gluconate and insulin with dextrose. B. Recheck potassium level in 1 hour. C. Administer furosemide per PRN order. D. Document the finding and monitor cardiac rhythm. Answer: A. Notify provider and prepare calcium gluconate and insulin with dextrose. Rationale: life-threatening hyperkalemia requires immediate cardiac protection. Ca gluconate and potassium shift insulin. Monitoring and rechecking delay life-saving care. Question 8. A nurse is delegating tasks to a newly trained UAP during a mass casualty event. Which delegation reflects effective clinical judgment? A. Assign the UAP to perform vital signs on unstable trauma patients. B. Ask the UAP to assist ambulatory victims to a safe area for triage. C. Instruct the UAP to document triage findings. D. Assign medication administration to UAP under supervision. Answer: B. Ask the UAP to assist ambulatory victims to a safe area for triage. Rationale: delegation must match competence and scope. UAPs can assist stable or ambulatory clients but cannot assess, document triage, or medicate. Effective triage uses limited staff safely. Question 9. A patient with COPD on 2-liter O2 becomes restless and confused. What is the nurse's next action? A. Assess for CO2 retention and obtain ABG results. B. Increase oxygen to 6 liters per minute immediately. C. Administer prescribed sedative to calm agitation. D. Encourage coughing and deep breathing exercises. Answer: A. Assess for CO2 retention and obtain ABG results. Rationale: confusion in COPD on O2 may indicate CO2 narcosis. Increasing O2 can worsen retention. ABGs confirm and guide management. Sedation masks symptoms. Question 10. A nurse is caring for a client receiving high-dose IV vancomycin who develops decreased urine output and elevated creatinine. What is the best clinical decision? A. Hold vancomycin and notify provider for renal evaluation. B. Continue dose and push oral fluids. C. Administer diuretics to increase urine output. D. Reduce infusion rate to half. Answer: A. Hold vancomycin and notify provider for renal evaluation. Rationale: nephrotoxicity from vancomycin requires holding the drug until evaluated. Continuing or adjusting dose without order risks acute kidney injury. Diuretics worsen nephrotoxicity. Question 11. During a shift, a nurse observes another nurse giving medication without verifying the patient's ID. What is the nurse's ethical responsibility? A. Report the incident to the charge nurse immediately. B. Ignore since no harm occurred. C. Confront the colleague privately later. D. Document a near miss in the patient's chart. Answer: A. Report the incident to the charge nurse immediately. Rationale: unsafe practice compromising safety must be reported through the chain of command to prevent harm. Ignoring or informal correction lacks accountability and risk prevention. Question 12. A nurse suspects child abuse when a mother provides inconsistent explanations for her toddler's bruises. What should the nurse do first? A. Report the suspicion to Child Protective Services as required by law. B. Confront the parent and demand explanation. C. Photograph bruises for evidence. D. Discuss findings with family before deciding. Answer: A. Report the suspicion to Child Protective Services as required by law. Rationale: mandatory reporting laws require immediate reporting of suspicion, not proof. Documentation and provider notification follow. Confrontation risks escalation and delay. Question 13. A nurse is caring for a postoperative client on PCA morphine and IV fluids at 150 milliliters per hour who develops pulmonary crackles and dyspnea. What should the nurse do first? A. Slow the IV rate and assess lung sounds, oxygenation, and urine output. B. Discontinue PCA and call the provider. C. Elevate HOB and continue infusion as ordered. D. Administer furosemide per standing order. Answer. A. Slow the IV rate and assess lung sounds, oxygenation, and urine output. Rationale. Assess and mitigate cause, fluid overload, before escalating. Rapid assessment prevents worsening pulmonary edema. Stopping PCA may be secondary if opioid sedation suspected, but first step is addressing the fluid overload pattern. Question 14. A nurse notes an elderly client's new onset of irregular pulse and confusion while on digoxin. What is the most appropriate initial action? A. Check digoxin level and serum potassium. B. Notify provider immediately with findings. C. Hold digoxin and obtain ECG. D. Administer antidysrhythmic as prescribed. Answer. C. Hold digoxin and obtain ECG. Rationale. Suspected digoxin toxicity requires immediate hold and rhythm assessment. Lab confirmation follows. Reporting B is important but comes after initial safety step. Question 15. The nurse notes a postoperative client's drain output increases from 30 milliliters to 150 milliliters of bright red fluid in 1 hour. What should the nurse do next? A. Check vital signs and notify provider of possible hemorrhage. B. Reinforce the dressing and monitor output. C. Continue routine monitoring and document. D. Apply pressure dressing and wait for order. Answer. A. Check vital signs and notify provider of possible hemorrhage. Rationale. Sudden increase in bright red drainage signals active bleeding. Assess perfusion and report urgently. Reinforcement B. Delays recognition of shock. Question 16. A nurse caring for a client with acute stroke and dysphagia notices coughing during water intake. What is the priority nursing intervention? A. Stop oral intake and request a speech-language evaluation. B. Offer thickened fluids and re-evaluate swallowing. C. Encourage slow sips with chin tuck. D. Document and continue monitoring. Answer. A. Stop oral intake and request a speech-language evaluation. Rationale. Aspiration risk. Stop oral feeding and request swallow evaluation. Continuing oral intake risk pneumonia. Thickened fluids B or positioning C. Require confirmation first. Question 17. A nurse caring for a client in restraints notes skin breakdown and family concern about comfort. What is the most appropriate response? A. Remove restraints temporarily and reassess need. B. Reassure family restraints are necessary and continue. C. Document breakdown and apply ointment. D. Inform family that provider must assess tomorrow. Answer. A. Remove restraints temporarily and reassess need. Rationale. Restraints require ongoing reassessment and must be removed periodically for circulation/skin checks. Comfort and safety come first. Passive reassurance is inadequate. Question 18. A client receiving total parenteral nutrition, TPN, develops diaphoresis, tremors, and confusion during tubing change. What is the nurse's first action? A. Check blood glucose immediately. B. Call provider to change TPN rate. C. Administer insulin per sliding scale. D. Increase infusion rate. Answer. A. Check blood glucose immediately. Rationale. Sudden hypoglycemia can occur during TPN interruptions. Immediate glucose check confirms cause before any intervention. Increasing rate or insulin worsens hypoglycemia. Question 19. A client with ESRD refuses dialysis today, but is alert and oriented. Family insists it proceed. What is the nurse's next step? A. Respect the client's decision and notify the provider. B. Encourage family to persuade the client. C. Proceed with dialysis to prevent legal action. D. Call ethics committee before doing anything. Answer. A. Respect the client's decision and notify the provider. Rationale. Autonomy prevails. Competent refusal must be honored and communicated promptly. Ethics consult may follow if conflict escalates. Forcing treatment violates rights. Question 20. A nurse notes a new grad administering insulin glargine and regular insulin in the same syringe. What should the preceptor do first? A. Stop the procedure and explain that they are incompatible. B. Allow completion, then report to supervisor. C. Document the error afterward. D. Prepare a second syringe for next dose. Answer. A. Stop the procedure and explain that they are incompatible. Rationale. Preventing medication error before it occurs demonstrates real-time clinical judgment and patient safety advocacy. Waiting or reporting later allows potential harm. Question 21. A 5-year-old with cystic fibrosis presents with thick respiratory secretions, dyspnea, and oxygen saturation of 88%. The nurse notes the child is anxious and restless. What is the nurse's priority intervention? A. Notify the healthcare provider immediately. B. Encourage the child to perform coughing and deep breathing exercises. C. Administer prescribed chest physiotherapy and suction as needed. D. Increase the child's fluid intake. Answer. C. Administer prescribed chest physiotherapy and suction as needed. Rationale. The priority is to improve oxygenation by clearing airway secretions. Chest physiotherapy and suction directly address airway obstruction. Anxiety and restlessness indicate hypoxia. Increasing fluids and encouraging coughing are supportive, but not the most immediate intervention. Notifying the provider comes after immediate nursing action. Question 22. A nurse is caring for a 3-year-old admitted with dehydration due to gastroenteritis. The IV line infiltrates, and the child becomes irritable and lethargic. What is the nurse's first action? A. Restart IV access in the other arm. B. Assess capillary refill and vital signs. C. Notify the healthcare provider. D. Administer an oral rehydration solution. Answer. B. Assess capillary refill and vital signs. Rationale. Clinical judgment begins with reassessment to determine severity of dehydration and perfusion status. Restarting IV access may be necessary, but the first step is reassessment. Oral rehydration is not appropriate for lethargic children due to aspiration risk. Question 23. A 10-year-old post-appendectomy patient reports sudden sharp abdominal pain and distension. The nurse observes pallor and tachycardia. What should the nurse do first? A. Reposition the child for comfort. B. Assess incision site for drainage. C. Notify the surgeon immediately. D. Administer prescribed analgesic. Answer. C. Notify the surgeon immediately. Rationale. Sudden pain with distension and pallor suggests internal bleeding or wound dehiscence, a surgical emergency. Repositioning or giving analgesics would delay life-saving intervention. Assessment is important, but the findings already suggest an emergency. Question 24. A nurse receives a pediatric client with suspected epiglottitis. The child has drooling, sits upright, and makes high-pitched sounds. What is the most critical nursing action? A. Prepare for immediate intubation. B. Obtain a throat culture. C. Encourage oral fluids. D. Administer oxygen via nasal cannula. Answer. A. Prepare for immediate intubation. Rationale. The child's airway is at risk for complete obstruction. Throat examination or oral fluids can trigger laryngospasm. Oxygen is secondary. Airway protection comes first. Question 25. A nurse observes that a toddler with meningitis has a bulging fontanelle and a high-pitched cry. Which intervention is most appropriate? A. Keep the child in a flat position. B. Elevate head of bed 30 degrees. C. Administer oral antipyretic. D. Encourage bright lights for assessment. Answer. B. Elevate head of bed 30 degrees. Rationale. A bulging fontanelle and high-pitched cry indicate increased intracranial pressure. Elevating the head promotes venous drainage. Flat positioning worsens ICP. Bright light increases discomfort and irritability. Question 26. A nurse caring for a 9-year-old with sickle cell crisis notes that the child's oxygen saturation has dropped to 90% and pain score is 8 out of 10. What is the nurse's priority action? A. Administer prescribed morphine for pain. B. Apply supplemental oxygen. C. Begin IV hydration. D. Notify the healthcare provider. Answer. B. Apply supplemental oxygen. Rationale. Hypoxia triggers more sickling and must be corrected first. Pain control and hydration are vital next steps, but oxygenation has immediate priority for tissue perfusion. Question 27. A nurse notes petechiae and bleeding gums in a child receiving chemotherapy. What is the most important intervention? A. Apply cold compresses to bleeding areas. B. Avoid rectal temperatures or suppositories. C. Monitor urine output closely. D. Encourage increased physical activity. Answer. B. Avoid rectal temperatures or suppositories. Rationale. Thrombocytopenia increases risk for bleeding. Avoiding invasive procedures reduces mucosal trauma. A. Cold compresses can help but are secondary. Activity increases risk for injury. Question 28. A 7-year-old with diabetes mellitus type 1 is found confused and sweating. Blood glucose is 45 milligrams per deciliter. What should the nurse do first? A. Administer half a cup of orange juice. B. Notify the healthcare provider. C. Recheck blood glucose in 30 minutes. D. Give insulin as prescribed. Answer. A. Administer half a cup of orange juice. Rationale. The child is hypoglycemic and symptomatic. Rapid glucose replacement is the immediate intervention. Rechecking glucose or notifying the provider comes after stabilization. Question 29. A nurse is caring for an infant with a ventricular septal defect showing signs of heart failure. Which intervention is most important? A. Cluster nursing care to reduce fatigue. B. Encourage frequent oral feedings. C. Increase fluid intake. D. Keep the infant in a supine position. Answer. A. Cluster nursing care to reduce fatigue. Rationale. Conserving energy reduces cardiac workload. Increased fluids worsen heart failure. Supine positioning may impair breathing. Question 30. A nurse caring for a 4-year-old post-tonsillectomy notices frequent swallowing and restlessness. What is the nurse's priority action? A. Offer ice chips for comfort. B. Inspect the throat for bleeding. C. Administer pain medication. D. Encourage deep breathing exercises. Answer. B. Inspect the throat for bleeding. Rationale. Frequent swallowing is an early sign of postoperative bleeding. Inspection and immediate reporting are essential to prevent airway compromise. Question 31. A nurse is assessing a 6-year-old with asthma who is using accessory muscles and cannot speak full sentences. What should the nurse do first? A. Administer short-acting bronchodilator. B. Obtain a peak flow reading. C. Encourage slow, deep breaths. D. Notify the healthcare provider. Answer. A. Administer short-acting bronchodilator. Rationale. The child is in respiratory distress and needs rapid bronchodilation. Assessment and notification follow after airway management. Question 32. A pediatric nurse receives an order to administer a medication dose that seems unusually high. What should the nurse do first? A. Administer the medication as ordered. B. Contact the pharmacist to confirm the dose. C. Clarify the order with the healthcare provider. D. Check the child's medical history. Answer. C. Clarify the order with the healthcare provider. Rationale. Nurses are ethically and legally responsible for verifying questionable orders before administration to prevent medication errors. Question 33. A 2-year-old with suspected child abuse has multiple bruises in various stages of healing. What is the nurse's priority? A. Document findings objectively and notify authorities. B. Ask the parents for an explanation. C. Report only if the child discloses abuse. D. Continue observation before reporting. Answer. A. Document findings objectively and notify authorities. Rationale. Mandatory reporting laws require immediate reporting of suspected abuse. Nurses do not need proof. Documentation and notification are legal duties. Question 34. A nurse notes that a child receiving IV antibiotics develops wheezing, urticaria, and facial swelling. What is the nurse's first action? A. Stop the antibiotic infusion immediately. B. Notify the healthcare provider. C. Administer prescribed antihistamine. D. Monitor respiratory rate. Answer. A. Stop the antibiotic infusion immediately. Rationale. Signs of anaphylaxis require immediate discontinuation of the drug to prevent worsening reaction. The next steps are airway support and medication administration. Question 35. A child with nephrotic syndrome is being discharged. Which parental statement requires immediate follow-up? A. I'll weigh my child daily at the same time. B. Will limit salt in the diet. C. I'll stop the corticosteroid when swelling disappears. D. Will monitor for infection signs. Answer. C. I'll stop the corticosteroid when swelling disappears. Rationale. Abruptly stopping corticosteroids can cause adrenal crisis. Parents must follow tapering instructions from the provider. Question 36. A 4-year-old undergoing chemotherapy develops a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius. What is the nurse's priority? A. Administer antipyretics. B. Notify the healthcare provider immediately. C. Increase oral fluids. D. Encourage rest. Answer. B. Notify the healthcare provider immediately. Rationale. Febrile neutropenia is a medical emergency. The child requires prompt evaluation and IV antibiotics. Antipyretics can mask symptoms. Question 37. A nurse caring for a newborn notes cyanosis that worsens with crying but improves when the baby is quiet. What should the nurse suspect? A. Transient tachypnea of the newborn. B. Tetralogy of Fallot. C. Respiratory distress syndrome. D. Patent ductus arteriosus. Answer. B. Tetralogy of Fallot. Rationale. Cyanosis with crying, tet spells, is classic for tetralogy of Fallot. Other conditions cause continuous or respiratory-related cyanosis. Question 38. A nurse is preparing to discharge a 12-year-old with new-onset type 1 diabetes. Which teaching point has the highest priority? A. Dietary planning and carb counting. B. Insulin administration and recognition of hypoglycemia. C. Exercise planning and activity limits. D. Peer support group information. Answer. B. Insulin administration and recognition of hypoglycemia. Rationale. Safety depends on understanding insulin use and early hypoglycemia management, which are life-saving skills. Question 39. A nurse finds a 9-year-old oncology patient crying and refusing medication. What is the most therapeutic nursing response? A. You have to take this or you'll get worse. B. Can you tell me what worries you about this medicine? C. I'll come back later when you calm down. D. Your parents want you to take it. Answer. B. Can you tell me what worries you about this medicine? Rationale. This promotes open communication, respects autonomy, and builds trust. Essential components of pediatric therapeutic relationships. Question 40. A 16-year-old requests confidential information not be shared with parents. What is the best nursing action? A. Explain that confidentiality will always be maintained. B. Promise to keep all information secret. C. Clarify the limits of confidentiality related to safety. D. Inform parents immediately. Answer. C. Clarify the limits of confidentiality related to safety. Rationale. Ethical pediatric care requires respecting adolescent privacy while clarifying legal limits. Confidentiality may be broken if safety is at risk. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.